Hello, I'm Jo from Specialist Language Courses. We are OET premium preparation providers. We are experienced and skilled in what we do, helping people achieve success in the OET exam. So in today's video, we're going to look at writing and OET letter types. We'll look at who you are when writing, who you are writing to, different letter types you might have to write, and what you might need to write about. Who are you? In the OET exam, you will be writing as your profession. So if you are a nurse, you will be writing as a nurse, perhaps to another nurse or another healthcare professional, for example, occupational therapist or a GP. And if you are a doctor, you will be writing as a doctor to perhaps a specialist, such as a gastroenterologist or cardiologist. For nursing, you might be a nurse working in a hospital, a nurse who's been visiting a patient at their home, a nurse at a GP surgery, or perhaps a nurse at a health centre. For medicine, you might be a doctor working in a hospital, or perhaps you are a GP writing about one of your patients. This is not an exhaustive list, so do be prepared to encounter a slightly different role. You will find information about who you are at the beginning of the case notes. Who are you writing to? So in the OET exam, it's very important to find out who you are writing to before you start analysing the case notes. For nursing, you might be writing to another nurse, and for medicine, to another doctor. Or for both nursing and medicine, you might be writing to another healthcare professional, such as an occupational therapist or a physiotherapist. You will find information about who you're writing to at the end of the case notes in the task, and it's really important that you read this first. What type of letters will you write? So in the OET exam, there are several different types of letters you might be asked to write, and it's important that you are prepared for any scenario. So for nursing, you might be asked to write a referral letter, for example, to a community nurse, a GP, or perhaps to a physiotherapist or occupational therapist. A discharge letter, for example, to the retirement home where the patient lives, or maybe to the patient's GP. And the third type of letter is a transfer letter, where you might be transferring or handing over the care of a patient to a community nurse at another health centre, or you might be transferring care from one hospital to another. For medicine, referral letters are common, for example, to a specialist, such as a neurologist, surgeon, endocrinologist, or another specialist. Or you might have to write to another healthcare professional, such as a physiotherapist, occupational therapist, or maybe even a dietitian. Discharge letters are usually to the patient's GP, and hospital letters might be for urgent admission, or you might refer your patient to a specific hospital, such as a psychiatric hospital or a paediatric one. So how does this affect the information you include in your letter? Well, reader awareness is key. You must know who you are writing to because it affects the information you choose to include in your letter. Ask yourself, who are you writing to? Why are you writing? What information is it essential for that reader to know? And what information is not needed? For more help on selecting relevant information, check out this video. What could you be asked to write about? Well, there is no exhaustive list of the things you might have to write about. On test day, you need to be prepared for anything. You need to be flexible and adapt to the task and the reader. In most OET letters, however, you will usually have to inform and request. You might need to inform the reader about medical treatment the patient has received, their current condition, interventions from other healthcare professionals, details of medication, or maybe upcoming appointments. And you might need to request further treatment, monitoring, follow-up care, further tests, or management of a medical condition. Again, there is no list of topics for the OET writing paper, but you could be asked to write about some of the following. For nursing, topics could be about wound care, medication compliance, administration of medication, parenting support, or perhaps even social needs. And for medicine, it could be advice on surgery, follow-up care, medication, tests, a diagnosis or management of a condition. Top tips for OET letters. Approach each task individually. You need to be flexible. Adapt to each case, and remember, there is no template for OET letters. Always keep in mind the reader and the reason for writing. So thanks for watching. For more tips and strategies, check out our website, link below. Please like and share with your friends so we can help more people achieve success in the OET exam. Don't forget to subscribe for more videos like this. Bye!